Let's go ahead and get started. Um, Today's presentation is a little bit about kidding and lambing. I did go slightly into a couple of different topics, but obviously we're not delving into them just because we're kind of constrained by time. Ah, there we go. Okay, so a couple of things that we need to take into consideration when we are looking at either kidding or lambing is obviously going to be um, what we're trying to get out of those babies. And so a lot of it begins with taking good care of the doe or the ewe. So we do have to kind of take that into consideration before we even start our breeding program. A couple of things that we want to make sure that we're aware of is our vaccination status for these animals. Invariably, if we start out with a well-vaccinated dam, and by dam I mean either a ewe or a doe, um, we're going to probably already profit when the time comes for that baby to be born. And so typically we're talking about vaccinating these dams about 30 to 60 days prior to breeding. Okay, so we're talking about 1 to 2 months prior to breeding, we go ahead and we give them our shots. And it can vary, different producers like different shots, and it's very understandable. Unfortunately, sometimes we do have vaccine reactions. Sometimes we have local knots. Goats, for some reason, tend to like to form knots on when they get the vaccine. So that might be one of the deciding factors into what vaccines that they get. When we're looking at the Campylobacter, that's the Campy vaccine, that one can tend to cause late-term abortions, as can the chlamydia one. And so if we've had any of that in our herd or our flock before, then that's certainly a vaccine that we might be interested in including. If that hasn't been a problem, occasionally people will not give that vaccine because they haven't really had problems with abortions. A very good one to give is a Clostridial 8-way. It can be a little bit harsh. So some people will just uh, break it down and give just the CD&T vaccine, okay? And that one does have the tetanus toxoid as well, which is a good one for us to include. Caseus lymphadenitis, if you've had a problem with CL, either in sheep or goats, it might be a good idea to include it. Some people do, some people don't. It's a little bit of a preference. If there is no problem in the herd or flock, I would typically not include the CL vaccine. Um, the other things to take into consideration, other than just vaccinating our animals, is, and again, we're not talking about just vaccinating the ewes and the does. We're also talking about vaccinating the males. And so it's a good idea to have a ram or a buck that's been vaccinated, again, 30 to 60 days prior to breeding season, so we know that they have developed the antibodies, and those antibodies can then be passed on to the offspring. When we're talking about deworming, it is important to take into consideration that we want to get rid of as many internal parasites in the dam as possible. There are a myriad of different types of dewormers that are available on the market. Ideally, you don't want to create a parasite resistance, and so you should typically try to rotate, not name brands, but rotate products. And so a couple of the ones that get used fairly frequently are going to be moxidectin, ivermectin. Some people will use praziquantel. Some people will use fenbendazole. All of those are good options depending on what you're looking for. If push comes to shove and you're not really sure, there's always a possibility of running a fecal exam and finding out again if there's a need to deworm against a certain specific worm. And again, we're not talking low parasite loads. Our main concern are very high parasite loads, because they can obviously be detrimental both to the dam and to the babies that they bear. When it comes to external parasites, we definitely want to avoid having any sort of KEDs or lice, any of these external issues that can end up, again, causing major problems for our dams and will ultimately end up affecting our offspring as well. Very good to use permethrin-based products. They're fairly easy to get and seem to have ample enough coverage for what we're looking for. Other things to take into consideration, we want to go ahead and have a decent body condition score. So we want that dam to be at her optimal best. We want to be assessing her every 2 to 3 weeks, make sure she's not getting too skinny on us prior to birthing. And we, again, don't want her to be too heavy either, because both extremes can end up causing problems at the time of birthing. Most of the gestations that you're looking at are typically going to be approximately 145 to 150 days. So you want to bring an animal into breeding that's in optimal condition, not over conditioned, which would be heavy, or under conditioned, which would be too light and could potentially have fertility issues. At the time of breeding, you want to make sure that you've got animals that are in good shape. And this is probably shortly after breeding is probably when you're going to want to do stuff like if you need to deworm, you need to shear, you need to vaccinate. That's the time when you want to worry about those things. You don't want to get into those stress factors right before kidding or lambing time because it can end up causing premature lambing or kidding. And sometimes those babies might not quite be ready to come out. If you are managing a larger flock or you're interested in perpetuity, then you definitely want to start documenting, how many successful births you have, either lambing or kidding. How many were born alive, how many were born dead, how many twins, how many singletons, how many triplets, and that kind of information. Which one of those dams had problems with their births, just so that you can have all of that information for the following season. You do want to avoid bringing any new animals in and around those pregnant ewes or does for obvious reasons. If they bring in any sort of a disease, you are essentially exposing that pregnant animal to other types of diseases. And that really is not the best time for them to try to fight a disease when they're getting close to parturition. So obviously biosecurity is the key. And we heard about biosecurity amply during COVID, how it is that you want to wash your hands, how it is that you want to clean and disinfect, how it is that you want to have a healthy, clean environment, making sure that you manage manure, making sure that you manage old feed, making sure that you manage clean hay or straw or whatever it is that you're working with, just to ensure success for that dam as much as possible. So this is a body condition scoring chart. And again, we're not going to go too much into this, but it is divided into 1 out of 5. So 3 is going to be the optimal condition that we're looking for. We want to, if we're looking at that ewe or that doe, and again, sometimes with the ewe, if they're fully woolly, that's a little harder to see. You have to actually place hands on them to palpate. You want to make sure that they're in a condition where they've got a nice ample amount of fat that covers the muscle, but you can still palpate. You can still palpate ends of the ribs. You can still palpate some of the backbone. You can still palpate the hips. You don't want them to be so heavy and so rounded that you can't feel anything. Okay, so when you're looking at body condition scores of 4 or 5, those animals tend to be a little too heavy, and they could end up having birthing problems in the future. So again, you want to make sure that you're not overfeeding animals or underfeeding them, because they do have problems birthing. They can also develop pregnancy toxemia, which could end up being a metabolic condition that could potentially seriously affect the capacity of that ewe or that doe to birth, and it could end up being deadly. And certainly they can cause vaginal, uterine, rectal prolapses, and all of those problems could end up being detrimental to the birthing process. So right when we're getting ready to prepare this ewe or this doe for birthing, we have to decide where it is that we're going to have these animals. So a clean, dry lambing or kidding area that's not going to be affected by major weather and cold is ideal. Most animals that are used to being outside prefer to be outside. So it's nice for them to always have a little bit of an option. But as the time gets closer and we're suspecting or we're starting to see signs of lambing or kidding, then that's the time when we really want to make sure that we've got an area safe for us where we can put that dam and make sure that we can monitor her. Prior to birthing, you do want to examine teats and udders and make sure that you don't have any lesions, you don't have any scabs, you don't have any scars, anything that could potentially affect these animals. You do not want to milk them, because the first milk that comes out is going to be the colostrum. And we really want to keep that in that ewe or that doe until that baby actually starts to nurse. Okay. But it's a good idea for us to at least be aware that we have these issues, and so that we can address them. And if there's any need for us to put any sort of medication, that we're taking care of that prior to the birth and not waiting until we've got a nursing baby trying to figure out what's going on with the teats or the udder. So how do we know that this dam is getting ready to kid or to lamb. And certainly what determines that are the fetal hormones. So when that baby is ready to go, that baby is ready to go. And baby is the one that says, okay, time to go, sets off all sorts of the fetal hormones, and the whole birthing process begins. That is the reason why we also don't want to stress the ewe or the doe, is because we can actually set off those fetal hormones, and then we could end up having issues where we've got a premature birth. The reality is, yes, we always say the lambing or kidding typically occurs during the day, usually around midday. The reality is, unfortunately, Murphy's Law, sometimes it occurs at the most inconvenient time for us. So typically we want to start watching and seeing what type of behavior we're having. If we're doing a good countdown, typically you want to start counting down the days as to when it is that you expect that that ewe or that doe to lamb or kid. A couple of signs that we might end up seeing, we've got an udder that's starting to fill out a little bit, so she's starting to develop a bag. We do have a relaxation of the pelvic ligaments, so that entire bag tends to hang down. The belly tends to hang down a little bit more. We start to see a vulva that's enlarged and it just looks swollen. And we start to see a loss of the cervical plug. So we might actually end up seeing a little bit of discharge coming from the vulva. And that does not necessarily happen immediately. It can actually happen even up to 1 week before the actual birth takes place. So those are signs of an impending birth, but it doesn't necessarily mean that the day that we see that is the day that they're actually going to kid or lamb. So normal behavior that we would anticipate in an animal that's getting very close to birth, to giving birth, is going to be restlessness, not uncommon. If you're still handling that ewe or that doe as part of a flock, we start to see that those animals start to separate themselves from the group. And we all know that, sheep and goats tend to be herd animals, and so they tend to like to stick with the group. So when we start to see that one animal starts to isolate herself, then that's probably a good time for us to think, okay, is this a pending birth? Is it time for me to maybe move this animal? Should I have moved her before? So those are different scenarios. Some people will just move them to the birthing stall immediately prior to giving birth. Others will move them a few days or a few weeks before. Invariably, again, because these are herd or flock animals, sometimes that might be a little stressful for them. Other people will actually not move them until they've actually had babies, and then at that point move everybody. But it's a good idea to have, at least on the back burner, have an area where you can take these animals when you need to or if you need to. Also not uncommon for them to stop eating, and that's usually about 3 hours. They really show very little interest in feed, especially the newer mothers as opposed to older, more seasoned ewes and does. We might see some nesting. They're going to be pawing at the ground. They're going to be restless. They're going to be moving around. They're going to be vocalizing. We might still be seeing some more discharge from the vulva, and occasionally that gets a little thicker. And then we should start seeing active contractions. And so at that point, you'll end up seeing an arched back, an animal that just can't get comfortable. She's getting up, she's getting down, she's getting up, she's getting down. It's fairly consistent. As long as that's going on and she doesn't seem to be in any major distress, all we're doing is observing her at that point. First thing that gets delivered, that bag breaks, and that's the first thing that comes out, and we typically see fluid. Occasionally, depending on where she's lambing or kidding, you might not actually see that. It might be missed, but that's usually the first sign that, okay, now we've got a birth that's taking place. So we typically divide for any species that birthing process into 3. So the first one is going to be at the point where we start seeing those uterine contractions, and that can last anywhere between 2 hours to 12 hours. We don't really know. Again, we see that restlessness. There might be some urination, not interested in food, getting up, getting down. So usually the signs are going to be fairly significant. What's happening at that point is that internally we've got a cervix that's relaxing, that plug is being released, and we've got a baby that's already worked its way into the canal, and it's starting to make its way out the birthing canal. The second stage typically happens about 1 to 2 hours in duration, and it can either happen when the ewe or the doe is lying down, or she can actually be standing. Either one of those two is going to be an option. Typically should not take very long. Once we start seeing those front feet come out, the majority of the bulk of the baby should be out within about 30 minutes to an hour. Okay. Ideally, what we're looking for is an anterior presentation, which means that the front limbs are sticking out and we've got a head between them. Potentially we could have a posterior presentation, which is where the back limbs are out first and both of them are extended. So sometimes we can't really tell just by seeing the hooves whether we've got an anterior or posterior presentation. And sometimes, if she's going to be having more than one baby, we can end up having an animal that's going to be resting between births. So it's not uncommon for them to take a couple of breathers. First baby passes, take a little break, and then potentially we start the whole process all over again. Approximately 6 hours later, and again, it varies. Usually we say a placenta will be passed anywhere between 4 hours to 6 hours. That's ideal. It can actually take up to 12 hours. We won't really consider it a dystocial till about after 12 hours, but you can comfortably wait until 18 hours and it could still potentially be normal. So anything that's over 18 hours old, that's when we're really saying, okay, we've got a retained placenta, we've got a problem here. That discharge that comes out from the uterus and from all the birthing fluids and all of that, that initially seems to be particularly heavy. And then as time progresses, it obviously starts to peter out. But it can be present for approximately 3 to 4 weeks. It's not uncommon for that to exist. It should not have a foul smell to it. It should have just a very normal generic smell. So,
quick question.
Yeah.
So going back to your previous slide, how long, I mean, we had a ewe last year that had trouble, trying to push out her second lamb. It, to the count, like at that 30-minute mark, she should have had that second lamb pop out, but after the 30-minute mark, do we start intervening, like getting in there to help her?
That's an excellent question. And we will get into that a little bit more. What we talk about is whether there's any progress or no progress. And I will show that and then we'll revisit your question.
Okay.
So when do we help and when don't we help? So the first one, I mean, the best scenario I can give you are Olympic divers, just because, you can really see what all's going on. So if you imagine the first one where that diver, where I have normal written, this one, if this is actually going to be the birthing canal and this baby's coming out, 2 arms sticking out, we've got a head sticking out, this is normal, this is ideal. Okay. Perfect scenario, we've got a nose that's down, that animal's going to land on the ground, we should have no problems. Why? Because the largest part of any baby is going to be the head, right? And so we want that head to come out first. Second scenario, not as good, but it still tends to work for us, is going to be where we end up actually having the head popping towards the top, nose sticking out. We still have legs that are coming out. So our presentation is still favorable. It's still considered an anterior presentation. Okay. We would prefer that the head be down, but it still ends up working for us. These are still going to be fairly easy for us to either help assist or for these to give birth. Third one starts getting a little more complicated. We might be feeling arms. We're not really feeling a head. This might be a situation where we might need to intervene and gently position or gently tug, slowly, very carefully, pulling. And the approach is to pull downwards to try to get this position to straighten out a little bit. Okay. But in general, we can still make this type of a presentation. Okay. We can make it an anterior presentation. So those are the ones that are fair to work with. This is where things get a little complicated. Okay. We've got a head sticking out. We've got 2 limbs sticking out. We don't really know where they are. And hopefully we don't have this where we've got one limb back and then the other one forward. Okay. If we end up having a breech, like this is where the baby's going to come out and we have a butt sticking out and we have no head that we can feel, no legs that we can feel, that's going to be a problem. And then this one where it's just a clumped mess and we can't even tell what's what, that's going to be problematic. Okay, so those are the ones where you're looking at the scenario and saying, this doesn't look like it's going to work out very well. So this might answer your question. So there's a couple of different reasons why we might end up having no progress. So we talk about we should see progress. About 30 minutes is kind of, it's a loose framework for us to work with. So one of the reasons why we might not see any progress is because that dam is fatigued. She might have ended up pushing for longer periods of time, a very long contraction. We talk about 2 hours to 12 hours, and she might be on the longer end of the scenario. And so by this point, she's fatigued, she's running out of calcium, she's running out of energy, she's not doing what she needs to be doing. In this scenario, ideally we want to get some calcium into her, we want to give her a chance, and we want to see if we can help promote the contractions And occasionally for something like this, if everything's placed appropriately, we're just not really seeing stuff happening. This is where we would potentially help her. The second one is a little more complicated. That cervix is not dilated, and so it just feels like it is closed. And we're seeing nothing come through because nothing can make it through. That one's going to require veterinary assistance. Occasionally, you can try to work your hand in and try to loosen up that vaginal canal so that we can get something to come out and get that cervix to open up. But the reality is that this one typically does require a veterinarian for us to have a live birth. And then the last one and the most common one is that baby's malposition. So a couple of different ways that we can see the malpositioning. We only find one hoof. So the first question is, okay, where's the other one? And what hoof am I looking at? This is a scenario where really somebody with small hands needs to go in and palpate and feel to see what's going on. If you can find a head that might be twisted back, if you can find a shoulder that's sticking towards the back and you've only got the front leg coming out, those are going to be scenarios that can still end up being corrected with some assistance. If you've got 2 feet but no head, you then have to figure out which feet you've got. And so question is, do you have the front feet or do you have the back feet? And a quick and dirty trick to find out whether you've got the front feet or the back feet is if you bend the first 2 joints. So if we were talking about humans, you would be bending the wrist and you would be bending the elbow. If it's front feet, both joints bend the same direction. If it's back feet and you were to bend the ankle and you were to bend the knee, they bend opposite directions. Okay, so that's a quick and dirty way to figure out, am I looking at front feet or am I looking at back feet? Okay, either way, you want to make sure, and ideally, if it's front feet, you want to try to position the head between the 2 front feet and go ahead and gently pull and create a little bit of traction so that we can pull that baby out. If it's back feet, you still want to end up correcting the position, trying to get the back feet to extend, and then making sure you have as much of the hips and the butt coming towards you so that you're able to pull out. The one thing to take into consideration is when you're pulling that baby out back feet first, that umbilicus is going to break. And so that baby is actually going to take its first breath while it's still in the vaginal canal. Okay. And so we really, really need to get that baby out in as quick and efficient a manner as possible. So it doesn't necessarily mean tug on the dam, but it means we need to be careful. Okay. And then we still need to figure out where that head is in the birth canal if we only have the 2 feet going on. Okay, so ideally, you've got 2 feet sticking out. We can figure out where the head is. We can pull that baby in a natural position. Second best case scenario, we're coming backward delivery. We're still able to position that baby such that it starts creating a straight line, a longitudinal line, and we're able to pull it. Worst case scenario, we're dealing with a breech. And those are a little hard because there's really, it's a very narrow space for us to actually get a hand in there, push the baby back into the canal, and then try to retrieve the feet. So that one doesn't typically work so well. So in general, the first 2, so we're talking about this one and we're talking about this one, we can typically get these fixed. Why? Because we've got enough space. This baby's really sticking out fairly decently. So our question is, we gently push it back, try to bring the head and the front legs forward, and then we go ahead and try to get this one to come out. Oops, sorry about that. Okay. The second one, we've got a head that's twisted, but we also have the birthing canal. This is one where we just have to go in, try to reach around the head, pull the head forward, and then we're going to create that natural birth. Okay, so this one we're creating the natural birth, this one we're creating the natural birth. They start to get a little more complicated as we progress. Okay, some of them, where you've got one leg that's tucked under the belly and then the other leg straightened out. Some of these, as they start getting more complicated, the more we mess with that ewe or that doe, the higher the likelihood that she's going to actually end up rupturing. And that's obviously not the goal here. Again, most of the times for us, and this is very common, you take somebody who has very small hands, and that's the person you're going to want to use to palpate and try to determine what they're feeling. Where's the head? Where am I feeling the hooves? Am I feeling a front leg or am I feeling a back leg? And they're going to be your best indicators as to what it is that you're doing. You want to make sure that you've washed your hands and you want to make sure you removed all of your jewelry, obviously, because otherwise you're going to potentially tear that vaginal canal. You could end up affecting the baby, or you could end up actually losing, some sort of jewelry inside the vaginal canal. That's certainly not ideal. You do want to wear gloves. Some diseases that these animals carry, and they are transmissible through the birthing fluids, and one of them that we described was Campylobacter. Those can be transmissible to humans as well. So you definitely want to make sure that you're wearing gloves. Nitrile gloves work really well. Those OB sleeves, the ones that are long that go up to your shoulder, work fairly nicely as well. And then you want to have some lubricants. So in a perfect world, you use something along the lines of KY jelly. There's also J-Lube. J-Lube is an obstetric lube that's used for working with cattle. It's just really, really slippery. And so sometimes that one can be a bit much. So KY jelly, the typical kind of jelly that you can find, or even rectal lube that you can find either through your supermarket or you can order it online, usually work very nicely. Again, you want to be gentle. You want to make sure when you're trying to retract that baby or you're trying to push it back in or trying to pull it out, that you're very, very gentle in your motions, okay? And again, it's never wrong to consult a veterinarian, to have somebody on hand that can talk you through it, or an experienced producer that has been dealing with lambing and kidding. Sometimes they can help you out and give you different tips or tricks. When you're dealing with dystocias, these usually end up being scenarios where you likely want to have an additional person, okay? It doesn't always work that way. Sometimes you're all on your own, but if you can have somebody hold the dam, it allows you to work on the back end. Okay. Sometimes, as we notice now that I'm putting a lot of fear into you guys regarding birthing, things don't tend to go as planned, okay? We can end up always seeing a vaginal prolapse. And the thing that we want to distinguish here is, okay, what is it that we're looking at when we're seeing this red bag? Is this vaginal or is this a rectal prolapse? And so definitely you want to pick up that tail and you want to see what is red. Is it the top or is it the bottom? If it's the top, it's going to be anal, and so it's going to be a rectal prolapse. If it's the bottom, it's going to be a vaginal prolapse, and so that's the one that's going to be affecting our birthing canal. It can happen prior to birthing. It might be very mild and you might not have any major issues. It might be pretty significant, and then you would have some issues at the time of birthing. It might be related to feed. It might be related, again, to, as we discussed, over conditioning animals. And so this is one of those situations where when we have animals that are too heavy, this is going to be a problem that could end up existing. Coughing can sometimes be a problem. If they're coughing consistently, they can actually prolapse their vaginas, and then we end up seeing this scenario. And then the other one that's held as one of the culprits is a tail that is docked too short. And so that predisposes some of these animals to having prolapses. The second one that we can have, which doesn't typically occur prior to birth, or we don't want it to occur prior to birth, definitely, is going to be a uterine prolapse. And so that's typically she's had her kids or she's had her lambs, and then as a consequence, 1 day later or 2 days later, we start to see this red bag. And so the question is, what is it that we're looking at? Is it small and we're just dealing with a vaginal prolapse, or is it something that's larger? Now we've got our uterus peeking out, okay? So that can be due to a loss of uterine tone, or it can be due to a loss of calcium. Calcium helps maintain some of that tone, and calcium helps those uterine contractions. So if we end up having an animal that's low on calcium, that's when we're going to end up seeing potentially that we have uterine prolapses take place. So definitely very important to make sure that we've got an animal that's adequately conditioned and that has appropriate minerals and is being fed appropriately. Other things that we can consider, again, is going to be a retained placenta, and sometimes they can be caused by selenium, lack of selenium, and we do have it in some areas of New Mexico for sure. Vitamin A deficiencies can tend to cause that. Sometimes it's a genetic predisposition, and occasionally it can just be a placental retention just because of the ewe or the doe herself. She may have difficulties retaining that placenta. Other times we can have infectious causes, and these are a little more concerning for us because they can have a component that can end up affecting humans as well. For these, you want to be very, very cautious. It's tempting to just hold on to that placenta and pull. Unfortunately, you're going to come back with a piece of a placenta, not the entire placenta. And so sometimes we have to give it a little bit of time and patience. And there is a possibility of actually getting small weights that you can put on that placenta to weight it down a little bit, okay? And so the idea is that with that weight, gradually that placenta will start to loosen up, and we won't end up bringing the entire uterus with us. It'll just be the placenta. You do want to make sure if that placenta starts to get fairly low, like below the level of the hocks. So if we've got a placenta that's starting to drag down around here, it's easiest to just tie a knot in it. So tie the placenta to itself so that it actually raises the level and she's not stepping on it, because stepping on it is exactly the same thing as somebody pulling on that placenta. It's going to come undone, but we're going to end up having part of a retained placenta in there, and then we can end up having a septic animal. Occasionally, we might need to reach for drugs that cause uterine contractions, and so we might be talking about oxytocin. The reality is that oftentimes, even when we end up having a retained placenta, and we wait, we give her time, as long as she's still interested in feed and she's interested in water and those babies are nursing off of her, sometimes that natural oxytocin will kick in enough that those uterine contractions will start taking care of that placenta. The placenta will actually be released on its own. So other things that can go wrong anytime we smell anything that just really doesn't smell right. So there are certain smells that we associate. You know, there might be a little bit of a bloody smell. There might be a little bit of a smell of urine. You know, these are smells that we expect to find in and around anything that deals with birthing. What we don't expect is a very strong kind of knock your socks off type smell. And again, that can be due to when we're starting to get into situations where we might have a little bit of rotting going on. So retained placentas that have been there for days on end, they start to smell pretty rank. Stillbirths, mummies, those are all going to be scenarios where we've got some rotting taking place. And so those bacteria that are released are the ones that are creating the smell. They are going to be a little bit more complicated for us, and that can end up being a situation where those animals need to go on antibiotics. They may need to be flushed because they have a propensity to become septic, and so we might end up losing the dam in the process. Other things that might go wrong, and this is more related to the time when we're getting close to parturition, so she's still pregnant, is that we can have some pregnancy toxemia. And so again, this is another one of those reasons why I can't caution you enough to be very careful about how you feed these animals, okay? We can create a nutritional imbalance that can end up then causing problems at the level of the calcium, different minerals. It won't set off the hormones that we need it to set off, and we're having an animal that both mechanically and physiologically is not able to give birth. Okay. It can also end up happening secondary to other conditions. You know, if she's been ill, if she's got a heavy worm burden, she's got other issues, she hasn't been able to eat right. Those could all be reasons to have pregnancy toxemia. But the reality is the majority of the times you're going to find it in overconditioned animals. Things to take into consideration, there is going to be a higher energy demand depending on the number of babies that ewe or doe is carrying. So again, you can see here 180% higher energy demand, and then 240% higher energy demand for somebody who's carrying triplets over twins. So those are things that are, over singletons. So those are things that are important to take into consideration. If there's a possibility of determining how many babies you have, or if there's knowledge from past births that she tends to carry 2 or 3, you know, that's important to take into consideration so that she can be fed appropriately. Okay, so again, what ends up happening, the reason why we have that pregnancy toxemia, we're not going to go into all the details, but the general idea is that they're not able to absorb that energy that comes from the gastrointestinal tract. So they start synthesizing it through the liver. And so then the liver starts being the main organ that's producing that energy. And because that liver was not meant to keep up for longer periods of time, it taxes the liver, and we end up having what's called fatty liver. And so that liver just gets overwhelmed and says, enough, I can't handle this. We can't do this anymore. And so that's when we start having problems. And when our liver enzymes go up in these animals, we start seeing neurologic signs. Okay, so you can have animals that are either circling, they're smacking their head against the wall so they look like they're almost blind, they're grinding their teeth, they're kind of not really focusing, and so that's called stargazing. You might have some that are unable to really stand and walk around normally. They kind of tend to topple and walk around like they're drunk. These are all signs of neurologic disease, and it could be secondary to liver issues, which is what's causing that pregnancy toxemia. So we do want to make sure that we've got good quality forage at all times. We do want to make sure that We're trying to avoid any sort of electrolyte imbalances. So we want to make sure that there's salt block, mineral block, all these things available to these animals prior to birthing. And then we want to make sure that we avoid anything like dehydration as well. Okay. Not a bad idea to have some source of calcium, especially if we're concerned that pregnancy toxemia might be an issue. Hypocalcemia is always good to have. Even if you don't give it prior to birthing, it's always a nice one to have if you start having issues. So not a bad idea to find, and they've got different forms, different gels, different tubes, liquids, different forms of getting calcium. So it's a good thing to have on hand as well. So now that I scared everybody, a couple of things. So postpartum care that we want to make sure, once we've had, couple of births or whatever we're looking at, we really should be able to feel or palpate the sides and the flanks of that dam and find out if there are any babies left. Okay. So kind of gently bouncing it up and down, gently bouncing it in and out, and find out if we can still feel the baby in there. If we're still noticing pushing, she might still end up having another baby that's retained. And so we definitely want to keep an eye on her and find out what all is going on. Okay, so not uncommon if we're still seeing pushing and we are way beyond the stage of where she produced one or two or however many babies she produced initially, we want to take that into consideration, okay, because she might still have one left in there. It might not be a bad idea. Again, person with small hands, put on an OB glove, take a good feel in there and just make sure that there's nothing else that's coming out. Placenta typically, we said, should be passed within 4 to 6 hours. We consider it retained as of 12 hours, but we really still don't end up addressing it until we're about 18 hours out, okay? And again, you want to make sure that she's not going to be stepping on it. You want to make sure that we give it time to try to release on its own. Sometimes they slip on their own, and other times we do have to wait them a little bit. But you don't want to tug on that placenta because it could end up creating more problems. You do want to make sure that you're seeing that neonatal bonding. So sometimes in new mothers, it's not happening. And you want to make sure that you try to have it happen as quickly as possible. So as much as you can, you want to make sure if you're going to graft animals, you graft them as early as possible. And that would mean switching one baby from the ewe or the doe that gave it birth to somebody else who's in the process of lactating, or you want to make sure that you see that there is a connection between the doe or the ewe with that baby. If that doesn't happen, then that might be a scenario where you are going to have to treat as an orphan lamb or kid, and you're going to have to feed it yourself. Okay. Always take into consideration that we could end up having what are called periparturient diseases, and we described some of those. So watching for prolapses, watching for mastitis, you start seeing that she's reluctant to let those babies nurse, or you start seeing an udder that's looking very red, looking very hot, just not feeling right, or we have any smells that develop that are just not what we would consider normal, natural smells. Those are always things to take into consideration. As far as the baby goes, for us, the baby is probably, obviously one of the things that we need to be concerned about, in the sense that those newborns really have very little to no defense. And so again, one of the things that we took into consideration when we were dealing with that baby was, we wanted to make sure that it had the best opportunity to make it in life. And so that's why we vaccinated the dam. So that's why we end up having a baby that hopefully has antibodies that it has received through the colostrum. So as much as possible, we want to ensure that that baby gets that colostrum. Okay, the colostrum is going to be that first milk that comes out. It's a little thicker, it's a little more golden color, and that is, in my opinion, liquid gold. So you want that baby to nurse within 30 minutes, and it might take up to 2 hours, and we're still going to be okay. But this is the prime time when that gut on that baby is actually open to receiving all of those antibodies. And so we want to make sure we ensure its chances of survival. If we start seeing that that baby really isn't nursing and we have the possibility to either milk that ewe or that doe and get some colostrum that way, it's well worth your while to go ahead and do that. You have to be careful with the suckle reflex and make sure that they actually end up swallowing it appropriately and it doesn't go into the lungs. But as much as possible, if you can get that baby to nurse, your chances of survival are definitely a lot better. Newborns are going to be very, very susceptible to hypoglycemia if they don't get enough energy fairly quickly, and they're going to be very susceptible to hypothermia. So we want to make sure that they do have a temperature controlled environment. We want to make sure that these animals are not, 99 degree Fahrenheit in temperature, rectal temperature. Usually they tend to be around the 102 mark, and that's kind of what we would expect. So if you start seeing that there's a drop, there's a little bit of sluggishness, this baby really isn't, it's going off in opposite directions or showing no interest, then we likely have a problem on hands. And the time that we can use to address that is fairly limited. So we really need to take advantage of that window and try to get that baby to nurse as quickly as we can. As far as the navel goes, definitely, if and whenever possible, we want to try to dip that navel, and we want to use either dilute iodine, or there's chlorhexidine, which works really nicely as well. We want to make sure that if we're using the iodine, you're going to want a weak tea color. You don't want something that's full strength, just something mild. You're going to try to use it to just disinfect a little bit of the surface. That's all we're looking for. They tend to seal fairly quickly, especially if there's no risk of infection. Those navels will tend to seal fairly well. Again, if that baby isn't nursing and you have the opportunity to give it some other form of colostrum, and some of these are available either through breeders or you can pick some up commercially, you just have to be prepared for it. There's obviously that colostrum that you can end up using. In the event that you have a doe or a lamb and you have a flock or a herd that's very large, and you end up having a doe or a lamb that does not produce live babies, it's worth your while to just go ahead and milk them, and then you can freeze that colostrum and use it for future animals. Okay, so that might be something to take into consideration. And I do believe we've got about 10 minutes for questions. Is that correct, Mikkel?
Yes, and you actually have a question in the chat box.
Okay.
One of the participants asked that I had a twin born second that was rejected by its mom. We cleaned out the nose and mouth, but she still was crackling in her breath. We think she had a respiratory problem. She did die 2 days later, but was there some antibiotics we could have given her?
Was this the second baby to be born, or was this the first?
It was the second. It was the second baby, much smaller than the first one.
Yeah, and so I think probably what ended up happening is by the time that second baby got there, it had already taken a breath inside the uterus and had probably already absorbed some of the, just taken in some of those uterine fluids. And unfortunately, those are really, really, really hard to save. You have to try to get as much fluid out as possible. But again, if the first breath that they take is fluid and it's not colostrum, the likelihood that you're going to be able to treat them is going to be really hard. So even the antibiotics that we have available on hand, the reality is I don't think you could have saved her. I think it was just, unfortunately, luck of the draw that she was born last. And so likely she started breathing earlier. And that's not uncommon that you have a crackling in her breathing. That's usually a symptom of pneumonia. Okay. Yeah, so she was probably born and she ended up aspirating some of that, either meconium, or ended up aspirating some of the fluid or something along those lines. And so her chances were not good.
All right. Thank you so much.
You're welcome.
So, Alex, around that respiratory problem, we did have a ewe, and she was one of our first ewe, was a first-time mom. And in the beginning of this year, in January, we gave them Barvac CDT and all to the pregnant ewes, and they pretty seemed like they were taking it well. But we had a problem with this ewe that when she had a baby, in the first couple weeks she was doing fine, but then that's when we kind of caught the sense that she was getting respiratory and pneumonia are two different things, right?
Respiratory can be divided into two. So you can have upper respiratory or you can have lower respiratory. So your lower respiratory is going to be pneumonia. And then your upper respiratory is just going to be like that raspy sound. You might have a little bit of a snotty nose, but it doesn't appear to be causing major problems with the full breath cycle that would be the lungs.
Okay. And that you said that was the lower respiratory, right? The
lower respiratory is pneumonia, yeah.
Okay. So the lamb did have lower respiratory starting in a couple of weeks, I say like 3 to 4 weeks after they were born. then it started having, the lack of appetite. It
Right.
really stink. The lamb really stunk.
Mhm.
And from there and after, her mobility was not, increasing at all. She could
Right.
only get up so far and she'll collapse. Then
Mhm.
when she tries again, she only gets a few steps in and she collapses.
Right.
So, we dealt with this year with
Mhm.
our first time ewe, and last year we had two of them that basically, died of, we think it's respiratory, but every time we take him to the vet, they give him LA 200,
Mhm.
but we end up losing all three of them. Is there anything that we could have prevented that to happen before we have taken it to the vet?
Well, that's a really good question. Occasionally, and it's not, unfortunately, it's not uncommon. You might have a little bit of a respiratory issue in your flock, and then maybe it doesn't affect everybody, but it sounds like it's a certain age group, correct? Like the 3 to 4 week olds.
Yes.
Yeah, and so my guess is that you've got something that tends to affect neonates or youngsters, as they're in the process of developing their own immunity. Because really, the first 30 days, and we tend to say, 6 to 8 weeks even, all they are using are their maternal antibodies. So whatever it is that they got from their mom, that's exactly what they have in their system. And then at that point, after about 4 weeks, they start to have to develop their own antibodies. And so I think that's where you end up having a little bit of susceptibility. What I would recommend, is that the next time that you have one of those babies, if you have another one of those babies, talk to
Mhm.
your veterinarian about submitting that baby to the lab and have a post-mortem done on it. And the reason why I'm saying that is because they can actually take some cultures and find out what kind of if it's a bacterial infection that's growing in there, what kind of a bacterial it is. And then that might set you up for success for the next time around, because then at least you know what it is that you might have on site.
So you're saying taking the lamb after, it passed or before?
Correct. Correct. No, if once that lamb passes, if there's a
Yeah.
possibility of swabbing that lamb and getting a good sample, that's an excellent opportunity. If not, and that lamb passes, I would just go ahead and submit the entire baby carcass to the
Mhm.
lab and have the lab, do a post-mortem on it and find out what
Yeah.
all is going on there. Because likely, when you start noticing kind of that nasty smell coming
Yeah.
like from the face and from the nostrils, likely you've got a bacteria that might be growing inside the lungs at that point, and that's why they're not surviving. And so once those animals get very, very weak and they stop eating, and they're, if it's between eating and breathing, they're going to choose to try to breathe. And so therefore, that's why you're having problems, once they get to that point where they're so weak that they can't stand up. Okay.
And
So those are usually the ones that you're going to end up losing. But it would probably be a good idea, if you start seeing that they're kind of going that direction. It might be worth your while to see if you can get them to the lab, or talk to your veterinarian about
okay.
getting them to the lab and culturing them. Yeah.
Okay. And another
Excellent.
question,
Mhm.
we had some of our neighbors dealt with this too, or not, we haven't dealt with it at all, but our neighbors did deal with their lambs, particularly have, they stayed small for months and
Mhm.
they just, they weren't growing, they weren't
Mhm.
progressing in their growth. What could be the reason for that? Because they were just, they stayed small, and we had this question pop up last
Right.
week during the sheep shearing
Mhm.
workshop that was hosted in Shiprock, and the guy that had mentioned about the sheep was that um the lamb the sheep drop a lamb and that lamb stayed small for months,
Mhm.
and it didn't progress at all too.
Mhm.
Could that been like part from the ram, the what do you call it? The soundness exam? Could it been from that ram, or it could, been from another
Well,
as well?
I think a couple of things that I would look at is definitely, if that's a proven RAM and you've never had any issues,
Mm-hmm.
likely I would not really anticipate that it's related to that. Now, that being said, there are some males that will throw smaller animals, and that's not necessarily a bad deal.
Yeah.
Um, if you have animals that are born an appropriate size and then they just fail to thrive, they're just not growing right, I would check to see how much milk that ewes producing. Because if she's not producing enough milk, she's probably producing enough to keep them alive, but she might not be producing enough for them to thrive. So again, it's going to depend, are they born small? And that might be related to genetics, or are they born normal size and they just don't thrive?
Okay, that's quite interesting. Thank you. Cotillion, you have your hand raised. Do you want to
Yeah,
unmute?
we had that problem about 2 years ago, Mikkel, and we don't take our sheep out to graze often, and it turned out like our oldest daughter, or our youngest daughter, did some research, and in our area, if they don't go out, then they lack selenium. So what we did is started supplementing selenium to the moms, and their growth was the following year we didn't have that problem. So just that, if they're just feeding hay from the barn, alfalfa or grass, they're not getting that selenium that comes from directly from the ground. Or if they're grazing in an area that's not too, that's over, what's the word? That's
Overgrazed?
overgrazed, yep.
Yeah.
So that I'm just offering that because we did go through that 1 year and we just bought the selenium. However, you have to distribute it or supplement it carefully.
Yes, absolutely.
So monitoring that, and then also keeping track of how much you're giving them, but it worked very well for us.
Yeah, selenium, yes, it's used to address, for example, white muscle disease, and sometimes one of the reasons that I would be suspicious that you might have a selenium deficiency in babies, if you end up having babies that are kind of all curled up and their joints don't really stretch out and they're stiff and they're not doing well, so you end up having a little bit of a malformation. That would be a situation where I would definitely think that there's a problem with selenium. And certainly in the Southwest, we do have areas that are selenium deficient, and that's another thing to take into consideration. Yes, you do have to be very, very cautious with how you give selenium, because you can end up reaching toxicity levels very quickly.
So is there a preference, as far as selenium goes? Is it better to have, those, like, I'm not sure, they come in like the bottle from Valley Vet, or they come in
so there's a product that's called Bose, and that's the one that you typically end up giving.
Bose. Okay.
Bose, B-O-S-E. Okay, and Bose is the one that typically you end up giving. You do need a veterinary prescription, so I would just touch base with your veterinarian and say, okay, this is what I'm dealing with. This is what we want to go ahead and treat. What do you think? And then if you are in a selenium deficient area, and that's, you can figure out whether you're in a selenium deficient area or, yes, you're right, an overgrazed area is very easy. You just go on a map and you can find it. Most of the time they'll list areas that have selenium deficiency.
Okay. Excellent. Thank you so much, Cotillion, for that, and Dr. Eknoff. I have so many other questions.
Sorry, Mickey, I have
participants
one more
allow.
question I really want to ask.
Sure.
In prior webinars, the CDT was recommended for, before breeding season to prepare the ewe to be healthy. But then in the prior webinars, I think there was a recommendation to also following it up 8 or 10 weeks after birth. Is that still something you recommend?
That's correct. So there's a couple of different ways that you can handle the CD&T vaccine. If it's an older ewe that has been consistently vaccinated, or a ram that has been consistently vaccinated, you are fine just doing your single dose, okay? Because she's already had established antibodies, so you don't really have a problem. I will typically, if I suspect either we have a wound or we have an animal that's sick, that might be a situation where you might reconsider boostering on an animal that's already been vaccinated. You booster the CD&T. For animals that have never had it before, so you do want to go ahead and do a booster, okay? So it's not wrong to, for example, for babies that were born, they were living off the CD&T the mom got, you go ahead and you give it to them, and then you might go ahead and give a booster after that. And that's not wrong to do. Okay, so again, when I mentioned out of all the vaccines, people have certain preferences for what vaccines they like to give. And, a lot of it has to do with the experience that you've had, the area of the country that you're in, what works for you and what doesn't work for you. But CD&T is one that I would never miss. Okay. The frequency you might end up changing, but I would always recommend giving a CDNT, especially because, even if you're like banding, weathering animals, or you're docking tails or anything like that, you are going to create a wound, and these animals are so susceptible to tetanus that, giving that CDNT at least covers you for that. And then for any sort of septic diseases, that's where the C and D come in and play a role as well. So
Right,
yeah,
thank you.
excellent question.
And as far as like, the injection site goes, I get people that say it's okay to apply it in the foreflank and sometimes are either in the neck. I have family of sister that does, given shots in the foreflank. Is that something that is, done correctly, or we should be giving it, in the neck?
I personally prefer the neck. I think it's an easier area to reach. I think but there's nothing that tells you what you're going for most of the time is for subcutaneous shots anyway. If you're going to be using muscle, then you definitely want to go for some of the larger muscle groups, and definitely, the neck would be a good one. Shoulder would be another one, and then the back leg would be another one. But again, they all have their side effects. So if you're going under the skin, any area where you have an ample amount of skin that you can stretch would be fine. And so the foreflank does work quite well for that. Personally, I would stick to the front end, and that's just because if there's going to be any other reaction, I really want to know. It's more logical for me to see it on the front end than it is on the back end.
Okay. All right. And another question, and this one came up. We had our neighbor that had a 1-day-old lamb that just popped up last week, and she was asking, her belly was bloated. Is that what would be the cause of that? It was a 1-day-old lamb that just ended up with a really big pot belly, and it wasn't passing any gas, or it wasn't pooping either.
Okay, was it urinating at all either?
No.
Okay, so sometimes you can end up having, for example, a ruptured bladder. And urine, when it's still in the body, is actually sterile. Okay. So it won't necessarily kill the animal immediately, but you can end up having, because the urine has no place to go and it's not actually being emptied out, it can actually turn into a little bit of a pear-shaped bloated appearance. That would be one of the scenarios. The second one would be an animal that's losing protein, but the likelihood for that animal would even make it a day is not very high, because really at a day of age, all they're drinking is milk. So my guess is that it was probably a bladder rupture, if I had to hazard a guess. And my guess is that you could probably kind of bounce that belly around a little bit.
Yeah, so what we did is I'm not sure if this was supposed to be good or not, but we tried mixing water and baking soda together and giving it to her to neutralize the gas. And we just kind of massaged that lamb until he passes gas, because he looks like he was trying to pass stool, but he couldn't.
Oh, then you're probably dealing with you're probably dealing with a meconium retention, where they're supposed to pass their first stool. And was that baby not nursing?
It was, I mean, right when it came out, it was lying around, but then after that, he wasn't trying to nurse. Yeah.
So likely in a situation like that, you're absolutely right. It could have been some form of a constipation when they don't pass that first meconium, which is that first stool that babies will pass when they're born. Okay. Usually, milk in and of itself is a laxative. So when they start nursing, that acts as a laxative and it starts the digestive tract working, and they're able to pass stool. And so if they're not able to pass it, then that's typically where you're going to start having some of those scenarios like what you're describing. If it's more fluid filled and you can actually bounce that belly all over the place, that's going to likely be a urinary problem. But I think what you're dealing with, especially because you had a response and that baby was able to pass stool, likely you were dealing with an impaction, a meconium impaction.
Interesting.
Yeah.
I have more questions, but I want to give the participants the opportunity to have their questions answered. Folks that are still on here, I see some of you are still in there. If you have any questions, feel free to unmute yourself or answer them in the chat box. Okay, well, that leaves more questions for me then. So, the next question I had was, last week, I know that there's this number kicking around from as how much copper a sheep can take, and I hear 15 and I hear 25. I hear people say, no, it's gone up from 15 to 25 parts per million. Which one is it? Is it they can only consume 15 parts per million, or can they consume a maximum of 25 parts per million?
You know, copper is one of those things that just puts the fear of God in my heart. It really does. You know, and I always try to be really, really careful about anything that deals with, you know, how much are we giving them? So in my opinion, less is more. And again, you're not always controlling how much it is that each animal eats. So I would always go towards the smaller amount. You know, obviously there's supposed to be a little bit of a safety range, but even 20 parts per million for me, quite honestly, sounds like you're heading towards the high end of stuff, and you could end up having a lot of problems.
And equivalently, like how much, because how much is a 15 parts per million? Like, I'm not sure if that made sense.
No, I guess I'm not understanding your question about the 15.
Like converting it to, is it like the size of, you know, a teaspoon, or
No,
it
it's
has
going to be
more than that?
minuscule amounts. So for example, when
Way
you
more.
look at say you look at a feed bag,
Uh-huh.
it'll tell you, you know, per scoop or per
Wow.
cup or per whatever, yeah, whatever it is that you're
Yeah.
measuring in, it'll tell you this is the number of parts per million that you have. So
Oh,
that is why you
okay.
use it. It is such a minuscule amount, but it's because when you're talking about toxicity levels, that safety range between not toxic and toxic is very, very small. And so that's why they're always telling you, you know, when you're dealing with sheep, you want to be very careful about the amount of different products you give them. Similar to selenium, you want to be very careful about the minerals that you give so that you're not going to end up intoxicating them, because that safety margin is very, very narrow.
Right. And in some cases, what if you gave, you know, over 15 parts per million to a sheep? Is there any sort of antibiotics, you know, that we can like give to the sheep? Because majority of the time here on the Navajo reservation, there's folks that live, you know, middle of nowhere, and their
Right.
access to the veterinarian is going to be an hour away
Right.
from either Gallup and Farmington. Then we have folks in Shiprock that their vet basically clinic just closed down, and the closest one to them is in Farmington, but Farmington can be expensive, and majority of our producers, you know, they don't have that fund to travel out there and get it seen. Is there anything that we can prevent it if we have a sheep that consume too much copper?
Oh, that's a really good question. I honestly don't know that there's what would be available on the market. I honestly don't know if something like propylene glycol or something like that would help for excess copper
Okay.
toxicity. So I guess I can't really answer that one to your satisfaction.
Yeah. Yeah, no, that's fine. I thought I could just, you know, ask you because someone came up with that question last week, and
Mhm.
the presenter, you know, didn't have an answer for the person,
Right.
because he ended up having a sheep that will eventually, you know, die, and he didn't know whether or not to save its life, or if
Right.
it's worth saving it or not. Um,
So the deal with copper and sheep is that, you know, it's not going to be the single dose of copper unless you just threw a whole bunch of copper at that animal. It's not going to be the single dose. It's going to be over a period of time. And so what ends up happening is that copper in sheep doesn't get processed very well, and so it ends up accumulating into the liver. Okay. And
Mhm.
so unfortunately, because it accumulates in the liver, and again, we mentioned, you know, like with the pregnancy toxemia, that liver finally gets to a point where it says, you know, enough, I'm not dealing with this. So there are products that you can end up using, but the goal is you have to strip the liver of that copper over longer periods of time. And so, you know, if you end up giving something that has a little bit of a high level of copper and then you back off, that liver should be able to handle that processing, and you should be able to eliminate the copper on its own. Okay.
Okay.
So
Okay.
there are products out there. I just don't honestly know if they are available to you know, to the average bear. It's something that, you know, I honestly don't even know that many veterinarians would even have.
Yeah.
It's an ammonia product that you would end up using for something like that. And again, it's not something that, you know, you would get commercially. So the reality is the best thing that you can do is try to avoid copper toxicity, or if you know that you're dealing with higher levels of copper, start to back off as much as
Okay.
you can. So typical signs that you're going to know that you're probably dealing with something that's not very happy towards the liver is you're going to start seeing that symptom of jaundice. So you're going to have like the whites of the eyes are going to start turning yellow, and most of the membranes, you know, if you don't have black mucous membranes, but if you have like pink mouths and stuff like that, they're going to start looking a little on the yellowed side.
Mm-hmm.
Okay. And so those are typical signs that you're probably dealing with something that is not liver friendly, and chances are if it's going to be something along the lines of copper, you're going to start losing animals. Okay.
Interesting.
So best thing that you can do is check those copper levels, make sure that you're feeding things that are feed that's appropriate for sheep as opposed to, you know, cattle or horses or whatever the case may be, and then make sure that you're maintaining those levels within appropriate range. But yeah,
Okay.
because parts per million is a very small amount, but because it just sits there as a residue, that's where we end up having problems with copper toxicity.
Oh, gotcha.
Okay.
Okay.
So it's not going to be one of those things, oops, you gave it this, so let's give it an antidote. Does that make sense?
Yeah. Yeah,
Yeah.
no, that makes sense.
Yeah.
And
So what you want to try to do is avoid getting that liver
yeah.
worked. Does that
Yeah.
answer your question a little bit
Yeah,
better?
no,
Or
that answers it perfectly. I've been waiting for your presentation to answer all these questions. Because you know, I don't live near Gallup or Farmington close enough to have, you know, a vet's
Mhm.
um full attention to have all these questions answered.
Right, right.
Um, and another one that we deal with is inverted eyelids. Is that a genetic defect? Because we always, not always, but like I shown lambs and twice I had two show lambs that had inverted eyelids and it had to be sutured. For our lambs, we always have to check the eyelids, but time to time we do see some that kind of roll in. But all the time we were told to from the vet out here in Farmington to
Mhm.
just push down that lower eyelid for a couple of minutes, leave it there, then do it again, like for a good 30 minutes.
Mhm.
Is that one method, or is there another method that we could, you know, done, or is this a genetic thing?
So yes, there is a genetic component to it, and so it's not uncommon in you know, either lambs or for example some of the Boer goats also have that issue where you just have those inverted eyelids. There's a couple of different ways that that can be addressed.
Mhm.
Um, I'll be honest with you, I'd never heard the treatment of just lowering the eyelid and pressing down and seeing if that takes care of it. Again, you know, I'm not going to see the stuff that's easy for a producer to fix. What I end up seeing is the stuff that, you know, you've already got an eye that's affected, and so you've got either an infection in the eye, or the animals got a very cloudy looking eye, or there's a lot of weeping going on. And so at that point, you know, tricks like trying to lower the eyelid and trying to get it to evert, so come out, and stay out. When I see them, they're beyond that point. Does that make sense?
Yeah.
Because usually if it's something that's minor or minimal, like for example, in some small animals, as in small babies, when they're a little on the dehydrated side,
Mm-hmm.
you might have some of those inverted eyelids, and then as they rehydrate, they start drinking milk and all that stuff. The eyes kind of bob back into the face, and you don't end up having that issue. But there is a genetic component to it. Suturing does work. Keep that suture in for a few days, and that works fine. There's another way that you can do it, which is to actually take small amounts of, and it can be something like saline solution, or some people will use like penicillin, and you're putting it very to the lower lid, and you're just putting a little drop there, and that drop will actually weight the eyelid to come out. Does that make sense?
Okay, so
Because you,
putting putting it in a syringe and just kind of
yeah,
making
you would actually have to
the
inject it. So
drops.
that's, yeah, and so that would be the other way that you can do it. And then there's a third way, which works really, really well, but it's obviously not a very nice scenario for them. And that's you can buy, and you'd have to talk to a veterinarian about it, but you can get like the little staples, the suture staples that they
Mhm.
put on skin, and you actually staple that lid open a little bit on the bottom. So kind of to the top of the cheek, you take a little pinch of skin. You have to see one first to know what it is that I'm
Yeah, I
describing. 'Cause
would.
obviously over the
Yeah,
phone it doesn't make any sense, and over the
right.
computer it doesn't make any sense. But so there are ways to evert it. Have you had success dropping the just gently holding the lid down, or has that not worked for you guys?
We've done that with some of the lambs because my sister has mainly Hampshires and Suffolks, and
Mhm.
we have some lambs that have dealt with some inverted eyelids, not on both sides, just at least
Mhm.
one side.
Right.
And the Dr. Heike from San Juan vet clinic
Mhm.
mentioned that we have to push down on the lower eyelid for a couple of minutes and let it go. But he also mentioned terramycin ointment to put in the eye, but that's only for pink eye or
Terramycin is an antibiotic that's going to work for pretty broad spectrum eye infection. So that's going to be treating the eye condition that I was telling you about. When you have that cloudy eye and you've already got an
right.
irritated eyelid, that's what the terramycin is going to be used for. But it's not going to stop the problem from. It's not going to resolve the problem. It's not going to take care of that eyelid being inverted.
Okay, but you said penicillin, right? You just put it
It's the
in.
injectable penicillin, and you would put just a small dollop in it. But again, my recommendation to you would be to have someone show you the first time
Okay.
before you do it. Okay.
Okay.
Otherwise, if it were anywhere else on the body, you're like, it'll be fine. But you poke an eye and it's not going to be very,
Yeah.
very
No,
cosmetic, obviously. So you definitely
right.
don't want to go there until you know what it is that you're doing. But yeah, so there are ways that you can work with inverted eyelids.
Okay.
It's not an uncommon problem, but there is a genetic component. So you start noticing that the same you always throws babies with inverted eyelids, then she might be something that you don't want to necessarily cross, or find somebody else to cross her with and see if that takes care of the problem.
Okay. All right. I'll most likely would rather go that route because I don't feel like stapling my
Yeah,
sheep's eyes.
well,
It's very
yeah,
uncomfortable with
unfortunately,
it.
you put the staple in and it works great, but you also have to take the staple out, and that's when things don't seem to go as well as they
Right.
because when you're taking the staple out, they're already a few days older and many days wiser, and so at that point you're trying to catch the sheep first. So yeah, it works a little differently, but usually the drop of penicillin, the advantage of that is that it absorbs on its own. So if it's a mild enough defect, that usually takes care of it on its own. If it's something more significant than that, then usually it would have to be a cosmetic process. But
Okay.
again, probably the best thing that you can do is start noticing who it is that's throwing those babies and seeing if you can cross her differently.
Okay. All right. And one last question for you. We gave our UCD Barvac CDT in January the
Mhm,
15th, and
mhm.
they dropped probably 6 weeks later. Um, would we have to give the lambs, a booster shot, like of the CDT? Would that be recommended?
What I would
No.
recommend is to give them a booster when at the point, if you're docking tails or you're doing anything like that, say about, 4 to 6 weeks out, then that's usually when you're going to want to go ahead and just plan on doing a CDT. That would be one of the options. If you're not docking tails or doing anything like that, and there's nobody who's injured, you can just, it's a little risky, but you can go ahead and do it just during your annuals.
Okay. Yeah,
Okay.
most likely I'll do that too. Because I haven't gave any vaccine shots to our babies yet. But can I still give it to them even though, their tails popped off?
Yeah. How old are they?
They are 2 months, around about 2.5 months.
Oh,
So they're
yeah.
quite big.
Yeah, you're probably fine to go ahead and do it.
Okay.
Yeah, so that those are typically going to be the times when you can go ahead and plan on giving that CDT. Definitely, your best approach, and it sounds like you're already doing it, is doing the use prior to birthing.
Okay. All right. I listened into your last session that you provided last year, and
Yeah,
that's
I
what I
gave you
started.
the vaccine
Right.
protocol, right?
Yeah.
Yeah.
Yeah. So I really took that into consideration and I actually printed out, the slides and I was like, okay, well, I told my husband, I was like, we're gonna do this. Because we need to vaccinate our sheep and we never did because our
Mhm.
family is more cattle people than
Right.
sheep producers. But I want to get into sheep and I want to protect them have them be healthy. And
Mhm.
so when you had your presentation, I was like, okay, we need to do this. At least do this is most important, is what Dr. Eknoff said. So
Oh, good. Well,
I
I'm glad
really
it worked
appreciate your
out. I'm
tips.
glad to hear that you've been using that. That's excellent news.
Yes, and the information, all the questions I had for you, thank you for answering them. I
You're very
took a lot
welcome.
of the Q&A, you guys. So please join in if you have a question. If not, then we'll go ahead and move forward to our closing. So if you guys have any questions, feel free to email me and I can email the question over to Dr. Eknoff. But with that being said, thank you so much, Alexandria, for coming on here and sharing all this great information. So I really appreciate it and I hope we have you back another time.
It's always my pleasure. Anytime. Thank you so much
Okay.
for having me.
Thank you.
You take care.
Okay, let's see. For those of you that are still hanging in, I just wanted to let you know that we do have a New Mexico Indian Livestock Days that's coming up for the month of May. And that one's going to be from May 15th, 16th, and 17th. We are going to have a booth there. So if you all are going to be attending, feel free to stop at our booth and get to know us and our team. And there's so much other, topics that are going to be discussed at the Indian Livestock Days. Topics include right here on the BQA update and certification, large animal rescue, ranch first aid, range evaluation, proper branding techniques, virtual fencing, water delivering and development, and New Mexico State vet update. So I would definitely, if you have nothing else planned for that midweek of May, I would definitely register right away because the registration for early registration closes on the 26th of April, which is this Friday. So if you want to hit that early registration, I would definitely scan that QR code and sign up. Other than that, after the 26th, it's going to be late registration. And I believe it's $25 higher, I think. But if you want to hit that early registration before Friday, by all means, there is a QR code and it's going to be all day on the 15th, 16th, and I believe the 17th is going to be half a day. This is going to be located at Route 66 Casino. I'm sure all of you know where that is, near Albuquerque. And we don't really have any webinars set up for the month of May, But I just wanted to thank everyone for coming on here. And I hope that you take a lot of information back with you and maybe develop some protocols for your sheep operation. And I just want to say thank you all, and I hope you guys all have a good night. So, just a little bit information about me. My name is Mikkel Silversmith. I am from Crown Point, New Mexico, and I am the project coordinator for the Navajo Sustainable Agriculture Project. All of you that are pretty much on here that are familiar, I see some familiar names, so you guys pretty much, really get the idea of how our introduction goes in the beginning of our webinars. And for those of you that are new, welcome. Thank you for coming out to our evening webinar today. So the Navajo Sustainable Agriculture Project is funded by the USDA Outreach and Assistance for Native Farmers and Ranchers and Veteran Farmers and Ranchers program. And we're underneath the New Mexico State University Cooperative Extension Service. Our project director, who's unfortunately not here today, he is also serving as a professor from New Mexico State University, and he is one of the many other folks that have developed the Navajo Sustainable Agriculture Project. And not only do we partner with New Mexico State, but also with Diné College Land Grant Office and Community Outreach and Patient Empowerment, which in most cases, we just call them COPE. And you see their information, their logos all over our flyers and our social platform. That's because they have a lot of expertise to share with our producers, and that can go from educating them in herd health, sheep production, and COPE does a lot of gardening information from what type of water storage, units that you can apply on your small backyard gardening, fresh vegetables, what to prep for, and drip irrigation and so forth. So that's definitely in the realm of how wanting our producers to improve their operations, both profitability and sustainability. And not only do we provide gardening, but we also do livestock related presentations, webinars, and workshops, both in person and online. So we do a lot of informational sessions, both in Eastern Navajo Agency and Northern Navajo Agency. And we have around about 2 webinars per month now. We narrowed it down since the COVID has already pretty much died down. We're out and about and trying to get our information and resources in the public and in person as much as we can. Secondly, we helped increase our producers' knowledge in the USDA programs, which is NRCS, FSA, RD, which is Rural Development, and RMA, Risk Management Agencies, and other resource providers. So every year we do a resource fair that includes the NRCS, FSA, and in some cases RMA, and on rare occasions rural development as well. And we also invite the Navajo Nation Department of Agriculture to share some information on the Agriculture Infrastructure Fund, which a lot of producers are quite familiar with. And so we always try to bring light to those programs that producers can apply for that can really help them in their operation. And not only do we provide this resource fair, but we also do conservation planning program that we have up and running now. And we helped over 200 producers in developing their basic conservation plans that they submit to the Bureau of Indian Affairs Natural Resource Department, which goes along with their grazing permit. And lastly, increasing the local production and consumption of fresh fruits and vegetables and healthy foods by Navajo families and individuals. That we are implementing gardening programs for individual families and as well as schools. So currently we are working with some schools around here. One of them used to be Newcomb High School, and we are currently working with Lake Valley in Ojo Encino.